Fibroids and cysts. Recognize the condition and start timely treatment. Hey! Subscribe to the channel, click on the bell and listen carefully. A lot of women during their lifetimes face fibroids or cysts, and sometimes both. They occur in different parts of female reproductive system, but sometimes their symptoms can be similar. We will cover the key differences between fibroids and cysts in this article. So how do you diagnose a condition and treat it? What risks might be present and how can they affect your quality of life, sex life, and motherhood in the future? Fibroids vs cyst, symptoms and diagnosis. Ovarian cysts are fluid-filled sacs that form in or on the ovaries. One type of cysts, a functional cyst, occurs quite often. Usually, ovarian cysts do not cause symptoms and go away fairly quickly without any treatment. But in some cases, large cysts may cause pelvic pain, frequent urination, and other symptoms. In that case, you should consult a doctor who will recommend appropriate treatment. Other types of ovarian cysts can represent tumors in the ovary. They can be benign or malignant. A doctor can diagnose this type of cysts with an ultrasound, and blood tests can be done to tell if the cyst is malignant. Such cysts are treated by surgery. Uterine fibroids frequently grow in the wall of the uterus and are benign. A doctor can detect fibroids during a regular pelvic exam. For accuracy, the diagnosis can be confirmed by imaging tests, ultrasound or MRI, which can provide the most accurate diagnosis. The most common symptoms of uterine fibroids are heavy monthly periods, pelvic pain, enlarged abdomen, frequent need to urinate, constipation, bloating, pain during sexual intercourse. Fibroids and cysts can often be misdiagnosed. Make sure that you are regularly examined by your doctor, and if any symptoms occur, consult a doctor as soon as possible. When choosing a method of fibroid treatment, you should understand all options available to you. There are surgical and non-surgical methods of treatment, such as UFE. If you are not receiving all answers from your doctor, or are not satisfied with treatment options offered to you, ask Dr. John Lippman for a second opinion. Before applying these recommendations, consult your doctor. Put a like under this video, subscribe to the channel, click on the bell and share this video with your friends.